From both ends of Pennsylvania Avenue, conflicting messages about COVID and a vaccine. From President Trump on whether he'll go along with the FDA's stricter guidelines on emergency authorization of a vaccine.
That has to be approved by the White House. We may or may not approve it. That sounds like a political move.
And from the head of the FDA appearing before Congress.
I want to assure you and emphasize that every one of the decisions we have reached has been made by career FDA scientists based on science and data, not politics.
But a recent poll suggests Americans have concerns about whether to trust a government-approved vaccine. An NBC News SurveyMonkey poll found 39% would get a vaccine if offered, 24% said they would not, 35% weren't sure. Now, a fourth drug maker, Johnson & Johnson, has started phase 3 human trials for its COVID vaccine. But its vaccine will require just one shot, not two. Do you feel political pressure in your company to produce a vaccine before Election Day?
We'll work very closely together with the regulators, but we are not subject to any pressure on speed.
With a death toll over 200,000, the CDC reports 90% of Americans are still vulnerable to COVID. And after the president recently downplayed the virus's impact on young people, the CDC director explained Americans between 18 and 25 make up more than 26% of new infections.
Even though they are unlikely to get seriously ill from this virus, they are major contributors to the spread of COVID-19 in our country.
Still in Congress, Senator Rand Paul challenged Dr. Fauci over his assertion that lockdowns and social distancing slowed the infection rate in New York City.
You were not listening to what the director of the CDC said, that in New York it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
Tom, meanwhile, those health officials also tried reassuring the public about any new vaccine by saying they themselves would take it.
Yeah, that's right. So this is Dr. Jouar, Dr. Hahn, Dr. Fauci, Dr. Redfield. All of them say that should an FDA-approved vaccine appear, they would take the vaccine and they would encourage their families to do the same. And how many times have you had this conversation with somebody in the family? If I get the flu shot, will I get the flu? The answer, of course, is no, but this question about COVID was posed to Dr. Fauci.
If I take a shot to get the vaccine, does that give me COVID?
Absolutely not. That would be impossible.
One other note here, they continue to insist that the entire public should now focus on getting a flu shot, and to do that before Halloween. Listen, it's not going to protect you against COVID, but it will protect you against the flu, and hopefully it will lessen the overload in the nation's ERs over the coming winter.